everybody, because of the snow day tonight, we're not going to have a chance to have lecture, so I thought I would put together a quick YouTube video for you guys to watch to finish out the last couple of slides here on the chapter 14 of the brain. I'm not really going to do any editing here, so please excuse me if this is a little bit rough. All right, so we were talking about processing of signals last time we discussed this, and the processing of signals is basically what happens between the sensory information getting into the brain and you using that sensory information to understand something about your environment. So for example, if we're just talking about general body senses, you could go outside right now. There's a lot of white stuff around there. It's cold. It's probably wet. There's wind blowing. All of those things are primary sensations, but you need your brain to put them together to understand that there's 4 inches of snow on the ground. Likewise, if you're using your visual senses, you might see an object in front of you. It's round, it's red, it's small. Those are things that are going to be picked up by the primary sense, the primary area for the visual senses. What that object is, how that relates to you, requires the use of an association area. So an association area is where complex processing happens. How do you take that information that's coming into the primary area and utilize it so it means something to your brain? So something that's small and red and round could be a Christmas ornament hanging on your Christmas tree, or it could be an apple. And how are you going to take that information and what does it mean to you? To do this processing, we use not only the primary information that's coming in to the visual area, but we also use things like our memory and our experience and our intelligence and judgment to make a more complete picture. So both sensory and motor systems have primary and association areas. Okay, so for the primary areas, each of the 4 senses has its own primary area. So what do we have? We have smell, we have taste, we have hearing, we have sight. So each of those senses has its own primary area, and each of those senses requires its own association area. So as you're seeing the small, round, red object, you're actually getting that information in the primary area, and you have to use your association area to know, what are you looking at? Is it a Christmas ornament? Is it an apple? One you wouldn't want to bite into, so you better get this right. We also have a primary area for your general body senses. So things that you can feel: touch, pressure, vibration, different types of pressure and touch, itch or tickle versus deep pressure. Somebody grabbing you, you would feel it differently. Temperature, is it hot, is it cold? Pain, does it hurt? And proprioception. Proprioception is a part of your body that can determine whether you're upright or laying down or slightly leaning off to the side. It's how we know our body's position in space. So all of those things are being sent into the primary somatosensory area, and that's seen right here in blue. I think you can see my cursor. It's shown here in blue, and we have already talked about the primary somatosensory area. We also call it the somatosensory cortex, and it is in the post-central gyrus right here. All right, we also have a primary visual area that's back here in the occipital lobe. And that's where all of your primary visual senses come into the brain. So the fact that you're looking at something that's round and red and small is going to be sensed in that area. The primary auditory area is right here. That's going to be in the temporal lobe. So the temporal lobe contains the primary auditory area, and the primary visual area is in the occipital lobe, and the primary somatosensory area is here in the parietal lobe. Remember that the central sulcus divides the frontal lobe from the parietal lobe. We also have a couple of primary motor areas, okay? So the biggest one, skeletal movement, is going to be in the primary motor cortex. That's in the precentral gyrus right here. You can see it's in red. It's got a number 4 on it. That's part of the frontal lobe. So the obvious question here is, which lobe is associated with the primary motor area? That would be the frontal lobe. We also have something called Broca's speech area. This is also a primary area because this is where production of speech is going to happen. The primary motor area is where the production of motor skeletal motions comes from, and Broca's speech area is where we're going to do some planning, but mostly the production of speech, so the actual motor movements that are associated with speaking. All right, this next slide shows the additional 2 sensory primary areas. The gustatory area is here. It's actually shown that it's part of the insula. And remember, the insula is that 5th lobe of the cerebrum that's deep. So the primary gustatory area, the place where your taste sensations come into the brain, are in the insula, and the primary olfactory area is here. It's actually in the temporal lobe. It's not in the insula, it's in the temporal lobe. So anytime you smell anything, those sensations, those very basic sensations, are going to be received here in the primary olfactory area. Okay, so one of the things I really think is interesting is you can make a map of either where information's coming in to the brain or going out of the brain. So remember, we have the motor area, which is in the precentral gyrus. So think of motor, think of your car, motor's in the front. Motor's in the front here, and the somatosensory area is in the post-central gyrus, so it's right behind the central sulcus. And we can make a map, and this is called a homunculus. And what it is if you're looking at sort of half of the brain, one hemisphere of the brain, so for one side of the body on the motor side, these are the areas that are going to be sending out the motor plan to various parts of your body. So for example, if you want to move your hand, you would be sending out motor plan from this part of the brain, which would correspond to, I don't know, if this is the longitudinal fissure, it would be maybe here. Okay, now what's interesting to note is that how big the area is on the homunculus doesn't depend on how big the body part is. It actually depends on how many receptors that you have, or how many, not receptors, what am I trying to say? How many neurons you have. So think about what's going on in the face. Look at how big, how much real estate the face gets in this map. It's like 1/3 of everything. And that's because you have a lot of muscles that are involved with either making expressions, moving your face around, or talking and swallowing and eating and all of that stuff, right? Whereas you really don't have that many muscles in the thigh. The muscles you have are big, but they're really, quite basic. In terms of the sensory side, so this is a homunculus of the sensory information. And again, look at how many sensors you must have in the face and lips, teeth, and gums. A lot of sensation here, whereas in your arm, you just don't have that many receptors there. You're not sending that much information to the body. Lot of area in the fingers and hands. Think about your fingers. Think about how sensitive they are to touch and pressure and temperature and things like that. Okay, so our association areas, we're finally here. So we've already talked about our primary area, and you're going to need to know which lobes the primary areas are located in. The somatosensory association area is shown here, numbers 5 and 7. So it's really very close to the primary area, okay? So the input's going to come into the primary somatosensory area through the thalamus, and the association area is going to help understand that information that's coming in, and it's also going to help store the memory of previous experiences, so you can learn from this and know what that sensation is very quickly next time it happens. Your visual association area is going to be right next to the primary area in the occipital lobe. So again, as the input comes in that you're looking at something round and red and small, it's going to recognize what that is, remember what it is from last time, and help you understand and process what you're seeing. The facial association area is down here, 21, 20, 21, and 37. So down here. This is an interesting area because it's specialized. So it's actually receiving information from the visual primary area and the visual association area, but it's specific to recognizing faces. So think about that, what that tells you. We have a really quite large portion of our brain that helps us remember and recognize other humans. So this must be an important trait for humans, that we can recognize friend from foe. Okay, the auditory association area is down here. Okay, so that's going to be in the temporal lobe and in the parietal lobe. So it's pretty close, but these two over here are actually in a different lobe. They're in the parietal lobe. And these are really important because when our auditory primary area actually picks up the signals, is it high, is it low, what kind of sounds are being made, is picked up, that basic information is picked up by the primary auditory area over here in the temporal lobe, 41 and 42. But the association area is going to help us interpret what is being said. The prefrontal cortex, that's way down here, all of this stuff, okay? And that's in the frontal lobe. And this is really important. The prefrontal cortex is really, oops, sorry, I'm getting a bunch of texts. The prefrontal cortex is where your personality is. This is where you have a lot of your interpersonal skills, what kind of, if you're a happy person, if you're kind of generally a crabby person, where your intelligence is, whether you make good decisions or you have terrible judgment, are you able to take in information and handle abstract ideas. This is where all of that happens. In fact, we've found out a lot of information about how this works based on damage that is done to this area. So if you damage both sides of the prefrontal cortex, so the left hemisphere and the right hemisphere, you end up really changing your entire personality. You become a completely different person. Whereas you might have been, a sunny, happy person before that, built up a lovely life and had a great network of friends. If you have damage to the prefrontal cortex, it often results in, a really about face in your personality and makes it very difficult for people to recover from that type of injury, not in a medical way, but in a fitting back into their old life kind of way. But the last association area here is the premotor cortex. And that's actually right here. It's right in front of the primary. What did I just do? It's right in front of the primary motor cortex. And it's going to receive information from various sensory areas. And it's going to help you plan movements in response. Those movements then get sent to the primary motor cortex before they are routed back out to the periphery. All right, so some disorders of the brain we need to talk about. The first one is called transient ischemic attack, or TIA, and this is where you have impaired blood flow to the brain. So the brain isn't getting blood, it's also obviously not getting any oxygen. This happens very suddenly, so it's not like you feel it coming on or anything. It can be 1 minute you're fine, the next minute you're having all these problems. And really the hallmark of this is that it usually resolves very quickly as well. It only lasts about 5 to 10 minutes. And it really seems to present as a stroke. You have dizziness, weakness, you can't speak, sometimes you can't understand speech, you can have drooping on one side of the face, you can have a headache, and either loss of vision or blurred vision. But again, it resolves fairly quickly. The next one on here is CVA, or cerebrovascular event. So this is a event that involves both the cerebrum and the vascular system, which would be your blood vessels. And this can be caused by a number of different things. You can have intracerebral hemorrhage, where the blood vessels burst and actually bleed out into the brain. So not only are you losing blood from getting around to the brain and bringing oxygen, but you're also having a bleed in there, which causes a buildup of pressure. You can have an embolism, which is a blockage of the artery. Or you can have atherosclerosis. And again, atherosclerosis is when you have a lot of plaque buildup inside the blood vessel, and it makes the interior of the blood vessel smaller and smaller and smaller, and so less and less blood can get through. Risk factors for this would be something like, your normal risk factors for pretty much everything: high blood pressure, cholesterol, heart disease, smoking, and obesity are all risk factors for having a stroke. One of the ways you can tell if somebody is having a stroke is to use the FAST test. And FAST stands for face, arms, speech, and time. And what's going on in the FAST test is that you look at somebody and you ask them to smile. And if they can smile, they're doing okay. If there is a stroke going on, what happens is one side of the smile will look normal and the other side either won't respond at all or will droop a little bit. You can ask somebody to raise their arms. So A is for arms. If they can raise both arms together and hold them up together, what you're testing for is whether the both sides of the brain are able to receive that command and carry out that command. So do your skeletal muscles work? Speech, again, testing two different things here. Can that person hear the phrase, remember the phrase, and mimic the phrase? Those are all testing whether the nervous system is working properly. Time means the quicker you can get this person into care, the better. Usually it's considered to be 1 hour is the golden hour, where if you can get them into treatment within an hour, most of the damage of a stroke can be reversed. However, it takes longer than an hour to get care. They could suffer permanent damage. Okay, a couple other disorders. The first is Alzheimer's. This is becoming more and more of an issue as more and more people are living longer. And Alzheimer's is characterized by a loss of memory, but there's also a lot of personality changes that happen. People can become paranoid, they can hallucinate, and they can certainly have a change of mood, which what that really means is that you can have somebody that's really quite kind and sweet and loving their whole life, and once Alzheimer's starts to take over, they can really become a completely different person. And this can be very heartbreaking because they don't remember you and they're acting like somebody totally different. In the brain itself, there are 4 areas that show differences. First of all, there's going to be a deterioration of the hippocampus. And again, the hippocampus is involved with memory, and so the loss of memory is as a hallmark of Alzheimer's. We also get the formation of beta amyloid plaques, and these are proteins, abnormal proteins that congregate in the brain. They're not inside the neurons themselves, they're around the neurons, and where a lot of these proteins start building up, the neurons die. They don't survive, and so you end up with plaques, which is an area with lots of protein and very few neurons. So again, no neurons means no action potentials. We also get something called neurofibrillary tangles, and these are filaments that are inside the neurons. So not only are the neurons dying and lots of plaque is building up, but you're having neurons that are abnormal as well. They have these long filaments inside them. Okay, the other disorder on this page is brain tumors. So, how many times have you had a really bad headache and thought, oh, I have a brain tumor? Brain tumors are actually quite rare. Most brain tumors are actually what we call secondary tumors. Secondary tumors are tumors that arise due to having a tumor somewhere else in the body that's metastasized to the brain. However, you can have a primary brain tumor. These are called gliomas. And the reason they're called gliomas is because they arise from neuroglial cells. So remember our 4 neuroglia: ependymal cells, astrocytes, oligodendrocytes, and did I say microglia? I think I said all 4 of them. Anyways, those cells can reproduce or divide, whereas our normal neurons do not divide, and they don't often form tumors because they're not doing any division anyway. Chemotherapy isn't usually very effective against brain tumors because of the blood-brain barrier. Remember, the blood-brain barrier keeps out most things that are not lipid soluble or have some other form of transport like glucose. Other disorders of the brain, you can have ADHD, used to be called ADD, but now we've added that hyperactivity because people that suffer from this aren't just having problems with attention, they also are often having issues with impulsiveness and hyperactivity. This is thought to be to occur due to issues with transmitters, the amount and type of neurotransmitters that are released. Microcephaly is also becoming talked about more and more. Microcephaly is essentially a congenital condition. Congenital means you're born with it, and you end up with a small skull and underdeveloped brain. And this always is accompanied by mental retardation. And one of the reasons why it's becoming talked about more and more recently is that people that suffer from Zika virus, women who have Zika virus and are pregnant, are finding that more and more they have babies that are born with microcephaly. And so you cannot recover from this. This isn't something that will get better throughout time. They have a very small brain and very limited brain capacity. What's scary about Zika virus is that it is spread by mosquitoes, and oftentimes you don't even know that you've had it. And so if you're a woman of childbearing years, you want to be really careful about Zika virus because you don't want to have Zika and have it impair your unborn baby. Dementia is just something that happens due to age. However, it can happen due to other brain disorders, and it's the loss of intellectual abilities. So you start losing your memory, you start forgetting things, and you start having problems with not only making decisions, but making correct and positive decisions. This is usually due to age, and it is progressive, so it's going to get worse and worse as you get older. Hydrocephalus is something we already talked about. This is when you have a blockage of the circulatory system for cerebral spinal fluid, and it causes cerebral spinal fluid to build up in the brain and put pressure on structures, as well as restricting oxygen and nutrients to brain tissues. And encephalitis is the last one, and this is where you have inflammation of the brain itself, and it's usually caused by a virus. All right, that is it for today. I hope you enjoy this very speedy and fabulous lecture that at least you didn't have to go anywhere to get. So send me an email if you have any questions. I will see you for the exam. Have a good weekend.